Welcome back to another video, you guys. I am so excited to be sitting down and filming again. By the time you are seeing this, I have not only completed my first quarter of nursing school, but I passed. I am so excited. If you guys have been watching since the beginning of this quarter, since quarter 3 prep started, you've been with me through it all. I literally failed my first exam, okay? So today I wanted to sit down and reflect and share with you guys all of my study tricks. I feel like I tried everything, I tried it all, and obviously something's gonna work for you. You just have to find what it is. So hopefully one of these methods of studying works for you. This quarter I took fundamentals, which is like foundations, that might be what it's called for you. And then I also took pharmacology, and then I took another class called foundations, and then I had a lab. So kind of a light quarter, but definitely a little intense for that first outing, back to school, wearing the scrubs, going to lab, doing the thing. Next quarter is about to be crazy. And don't worry, I'm going to show you guys how I'm prepping for that and all of that good stuff. But first, let's talk about this quarter. So basically, to like sum it all up, because the whole reason I started this channel was just to kind of share this journey and share all of it, which is like I went back and forth. I'm like, do I want to share that I failed my exam? Do I not? Like, I remember that dilemma in my head, and I'm like, you have to tell people that you failed this exam. Like, you'll come back, it'll all be okay, it will work out. And somebody left a really nice comment on that video and said, you know, that they thought I was going to do well. And sometimes you just have to fail that first exam, because it just shows you what you need to do better. And I cannot agree more with that. I have gotten 90s and above on every exam since. I've definitely found what works for me, and I definitely know what's expected of me in these classes and what I have to commit and give. So I would say my hardest class this quarter was definitely my fundamentals class. That was my theory class, and that was the class where I had all the exams that I was constantly talking about and studying for on this channel. I'd say second is probably my pharm class, and then I'd say third was probably foundations, not because it was hard, but because it was very time consuming. And then my easiest class was definitely my lab. We tested out on administration, Foley catheter insertion, sterile dressing change, and vital signs. So those were all of our like skill checkoffs, and they all went well. I passed all of them on the first attempt, which is great and super thumbs up. I wouldn't worry about your like hands-on experience. You're gonna get teachers that are like very nitpicky, but if you're just doing things the way that you're supposed to be doing them, I wouldn't stress about that. And then for foundations, that class was just so random, and basically it was just a lot of papers and one presentation. And that was just, like I said, time consuming. It was like every 2 weeks I had something due, and it was just taking up time for no reason. And then pharm. So I'm gonna go to pharm and save fundamentals for last. I'm just gonna talk about pharm for a little bit, what I did, what worked, what didn't, what I would recommend, what I think is important, what I'm gonna be doing with pharm moving forward now that a class is over. Okay, everybody said I was terrified about pharm. Everybody said it was the hardest class that they took, and if it was in person, maybe it would have been hard, but I personally did not find it difficult at all. I felt like everything that we needed to know in the online format was given to us. So I took pharm notes 2 ways, and I'm gonna show you both of them. So I have an iPad, and I got an iPad before school, and I love my iPad. I'm going to take my pharm notes on my iPad, and actually, I wanna let you guys know that probably not by the time this video is up. That's like kind of crazy, maybe, I don't know. And I'm definitely gonna put together like a pharm bundle and probably put it on like Etsy or something, and then I'll link it. So as soon as that's up and ready, it is something I'm working on. I'll share that with you guys, and it's something that if you're going into nursing school and you want some good pharm notes, you can use those. These are things that I got that I like haven't used, and maybe I will. This is just like little baby flashcards. Let me scooch back a minute. These are like DIY flashcards that our lab professor gave to us because we told her that we had like pharm stuff, and it basically is just like short, it's everything you need to know. So what I think I'm going to do with this is actually I'm going to get a little notebook for clinicals, and it's going to be my pharm notebook, because I have heard that sometimes at clinicals you're going to get professors that ask you, like, when you're doing med admin, like, what are you doing? What are you giving? What is the drug? What does it do? And Pharm does not leave you, okay? So even though it's online, it's really important to know that Pharm is a very important class. You're literally learning about medications that could hurt somebody, help somebody. So definitely not something to be taken lightly. So yes, if you guys have done something similar with the clinical notebook, definitely let me know and tell me what you think I should add to it. But basically I have these notes here, and then this was just a binder that I put together. And sometimes I just like wouldn't even have the time to do anything other than like write my notes out because my iPad was dead, whatever. So you'll see here, these are kind of my Pharm notes up close. Like when I would write them out, this is kind of what they would look like. And then these are basically drug cards. So what you see here, are the ring light. You see just different drugs and all of that good stuff. So this is kind of what they look like. So I have a couple of notes that I took that way, and then everything else is digitalized, which I'm going to show you right now. This is like kind of how they look for every single system, because that's how the Pharm class was organized. And then these are the notes that I'm talking about going and putting together on Etsy. I'm going to just hold it diagonal so that the reflection's not coming up. So you've got the endocrine system, and then basically just all these little key points that you need to know. Stuff about whatever, and then you're going to get into here, and these are going to be these drug cards. So we've got like oxytocin, levothyroxine, I'm probably saying these all wrong, but basically, and then like medications for pancreas. This is like, how does insulin work? And then insulin drugs, and it's all put together like that. This is like another one. This is like drug schedules, and I try to put graphics and like what do things mean, and I try to just keep them really neat. So like I said, I'm thinking about putting these on Etsy. If that's something you guys think you'd be interested in, let me know. Every Pharm class is different. We had weekly quizzes, and then we have like a discussion threshold that we have to meet. So it's like posting 3 times a week in the discussion forum, answering the question, weekly quizzes, worksheets, and a paper that we wrote. So I wrote my paper on TMP SMX, I think it was. I just finished my paper not too long ago. It was 6 pages long. I wrote it in a day. Oh, if you guys have seen my video, how I write papers in nursing school, this is the method never fails. So I had my paper on, let me see. Yeah, TMP-SMX, which is trimethoprim sulfamethox. Yeah, my Pharm notes don't say how to pronounce them. And now I'll talk about funds. You may have heard a rumor about the questions in nursing school, and the rumor is true. The questions suck. I am going to tell you this because it's just, nobody told me. Relax. Okay, the questions are different, yes, but like once you know the tricks, like the second exam, so I got a 72 on my first exam. Failing is below a 74. So I didn't do horrible. It's not like I got a 30% and I didn't know what I was talking about. I didn't know how to answer the questions. I'd get a question like, you know, you get a patient that's being transferred from the ER, blah, blah, blah is going on. What do you do? And I'd start thinking like, okay, well, why is the patient coming from the ER? And I would create like this whole situation where, you know, the patient lost its leg and it's coming up to the ER. I hyper focused on the questions and I totally missed the content. And that is easily like the best way I can describe what happened on the first exam. I did so much question prep. I feel like it was too much. Like I would just psych myself out. So on the first exam, you guys remember I printed all these questions. I've never done this ever. I stopped doing it. I was like, not helpful. I do not go through any questions except the questions at the end of the chapter when I feel like the day before the exam, when I feel like at this point I know the material, I feel really good about the material, I'm going to go back and answer those questions now. And that way I really can gauge where I'm at and what I don't know. I don't do any other questions because these suck. I just don't think that they are helpful. And also every school is a little bit different. So my piece of advice is remember your ABCs. If there is an assess. The first thing you always do, if you get a question and it's like, what are you gonna do? First, you're gonna assess the patient first. There is gonna be an answer choice, whether it says the word assess or not. It might say evaluate this, assess this. That's what you're doing. You are always going to assess your patient first. Airways, breathing, and circulation, your ABCs. It is always, you're gonna have questions. Pretty much you can always narrow it down to 2. And then you just need to ask yourself, what comes first? Assess, ABCs. That's it. Flashcards, personally, I think they're a waste of time. Flashcards are not what helps me. What I have found to be the most helpful, I have a friend and she's actually what inspired this, and she's such a gem. I went through the second chapter, the second exam, flashcards, everything. And then what we would do is we would do content reinforcement. So me and another friend, we would get together, we'd go to a whiteboard, which you guys saw, and we would write all of the information out, erase it, and then do it again. And we would just do it and do it and do it again. That, in my opinion, has been the most helpful. And then our other gem of a friend makes these cute little study guides, and this form of study guide really works for me. So she formulates it like a question and then answers, and this is really helpful because then me and my other friend, we like quiz each other back and forth. We'll get together, we'll go through a section, we'll talk about it, we'll add things to it that like aren't here, information that we think we should like know. And I'll kind of show you that here, and then we're able to do that. But you guys, the people you meet in school, like y'all are going through it together. Everybody needs to pass. Like we have a little group chat and it's like the 6 of us, and we all want to do really well, and we're constantly sharing information, sharing resources. I'm in a different lecture than them. So like when we do content reinforcement or she says something, like I'm texting about it in the group chat because I want my friends to do well too, because like it's marathon, you know, it's not a sprint, it's marathon. We got to get through all of these quarters together. So let's just do it together and let's do it well, and let's pass and encourage. I want to be very transparent that this study method did in fact come from my friend. The study guide that I'm about to share with you and kind of like all of that, it came from another friend, and I'll even like take this and I'll create like fake exams, and it's just collaboration is key. And I'm so grateful and appreciative that we have this like little group and we help each other out like this, because that's what it is. So it looks like this, and it just says like exam study guide at the top. Kind of show you guys, disregard my nails, okay? We're not allowed to have our nails done. So it looks like so, and this first unit was diagnostic testing. So I'll give you kind of an example of how this will get structured. So question 1 is, what is tested in a complete blood count? So she put hemoglobin and hematocrit. Is that how you say that? Hematocrit? I don't know. Hemoglobin, hematocrit, I don't know. Red blood cells, white blood cells, and platelets. Now, that's all that she put on that question, but when I would print this out and then I would bring it with me around, and you know, one day our professor said, there's going to be a question about hemoglobin A1C on the exam. So you can see I drew like a little line, said hemoglobin A1C, long-term compliance with glucose, normal is less than 6. So then when my friend and I would go through this, I'd ask her the question, and then I would say, okay, well, what is hemoglobin A1C? What's the normal value for hemoglobin A1C? And then what do platelets do? Because like platelets get tested, but what do they do? And then why would you check a person's white blood cell count? To monitor signs of infection. What do hemoglobin and hematocrit? Somebody tell me how you say it. What do those test for? Bleeding, anemia, renal disease. So these are all things that like we added, and like those were all things that we were able to add to enhance the study guide. And then I kind of would like highlight questions that I was like consistently getting wrong, or maybe I like didn't answer all the right way. And then sometimes I would add questions. Like one day we were talking about bladder scanners, so I added this question: what is a non-invasive way to measure urine volume? A bladder scanner. Same thing here, like what position is the patient in for a lumbar puncture? And then I would highlight like the L, and then they're in fetal position, so they're lateral. So that was like a little study trick for me. And then I added a question: where is the needle inserted? Just in case we needed to know. Add values, or, you know, this was a good one. What is a 3-way catheter? And like, when do you manually irrigate? When you have decreased urine output or you have a fear of a clot. And then I added, when you're connecting the syringe, how do you connect it? Is it, you know, do you twist it or do you insert it blunt at a 30-degree angle? So these are all things that we would do, and then you're able to go through section by section. And then like, here's a good example. We like messed up the gauge sizes for this. So somebody caught it, sent it, and then, you know, we're able to do that. I found, like I said, this really works for me. You might find that it works for you when you're going through your material, formulating it in questions, so that you make sure you really know your material. Because when you know the material, you're going to be able to answer the questions. So don't worry about the questions. Worry about knowing the material to make the decisions about questions. Another helpful hint is bring your textbook to class. Our professor is constantly giving us hints. I'm always adding these little tab thingies whenever she says that something's going to be on an exam. So, you know, she was telling us the other day, she was like, you better know this chart because this chart is going to be on your exam. So the chart is on the exam. I'm going to know the chart. The chart's going to end up in one of these, and it's going to be good. I wish you guys all the best of luck. Thank you so much for supporting me throughout this quarter of school. I'm so happy and giddy and just like so proud of myself for passing, and it's an incredible time, and it just feels so amazing, and I'm really, really nervous and excited for this next quarter. So any tips are greatly appreciated. Be on the lookout at Prep With Me. Quarter 4 of nursing school, we're almost there, you guys. I hope you guys have a great rest of your day. Thanks so much for watching. We'll see you next time.